I think that's safe to assume that all of us in this room have been into a hospital at least once in our lives. Each time that you go to a hospital, you want to make sure that you're cared for by a qualified health professional. You want that care provider to understand and appreciate your symptoms and subsequently treat you to the best of their ability. Now, wouldn't it be a cruel irony if these same healthcare providers become patients themselves because of something in the workplace causes them to be ill? Unfortunately, this is indeed a reality because healthcare workers are exposed to toxic hazards in the workplace. One example of such hazards is chemotherapy drugs. These drugs are given on a daily basis to treat patients who have cancer or other disorders. However, these drugs are also inherently toxic, meaning that they can cause adverse health impacts to those healthcare workers who handle them. These health impacts could be reproductive effects or cancer. To understand this problem further, I initially conducted a pilot study to determine the presence of these drugs on various surfaces in hospitals. I did indeed find contamination, meaning that occupational exposure is likely through dermal or skin contact of these contaminated surfaces. For my doctoral thesis then, what I'm trying to do is trying to quantify the exposure levels of healthcare workers to these chemotherapy drugs in select hospitals in Metro Vancouver. In order to do this, what I'm going to do is to sample workers' hands to see what level of contamination might be found externally, at the same time as collecting urine samples to understand what drug products might be taken into the system, so their body burden. I will also be surveying these same workers to understand their knowledge, perceptions, and practices related to chemotherapy drugs. Collectively, all this data, what I'm going to do is to put together a mathematical model to understand the determinants or factors which may lead to exposure to chemotherapy drugs. This is the first study of its kind in British Columbia, and it will allow policymakers such as WorkSafe BC, as well as the health authorities in and around the province, to understand the scope of this problem and in turn make changes to existing policies and procedures which are currently ineffective. There are a number of disciplines involved in the study. They include, but are not limited to, occupational hygiene, analytical chemistry, biostatistics, and population health. Overall, the goal of this study is to maintain the health of our healthcare workers so that they can continue to provide quality care that so many Canadians depend upon. Thank you very much.